You're really putting me, this is a good, okay, everyone's going to be like, she's crazy. My personal opinion, my personal belief is that I do not believe that young children should be taken to the mikvah for multiple reasons, or they're like, those are secular numbers, so they don't really affect communities. So the numbers themselves, right? If you look at the numbers in terms of from a secular space, are 1 out of 4 girls and 1 out of 6 boys will be sexually abused before they turn 18. The reality is, based on anecdotal experience from the mental health world, if you kind of ask anybody who works in this field, they will tell you that the numbers really do add up. They're pretty much the same in our communities. And what's interesting about it is that the numbers are most likely higher than even what's being reported, right? Because if we think about it, these are the reported numbers that are being recorded. And what we know about sexual abuse is that most are not reported, right? Average age of disclosure is about 50, in the 50s. So we know that it's not being disclosed. So most likely the numbers are higher. That doesn't happen in our community. That only happens in the modern Orthodox because they're so free about everything, right? Or no, that only happens in the really ultra Orthodox because they're so closed. It doesn't happen by us. It happens there, right? Because they don't talk about anything. The reality is that this is just part of the human condition, and it happens in every community. There is no community that is, out of the range of, having this happen in their world.
Welcome to Conversations with Shlomi.
Hi, I'm Shlomi, your host. I've discovered that vulnerable conversations lead to some of my richest insights and personal growth experiences. So join me as I sit down with guests who inspire me, and let's explore our ups, downs, and everything in between.
Enjoy listening.
Today I get to sit down on Conversations with Shlomi with Dr. Shani Verschleiser, a trauma therapist, an educator, trained in EMDR, somatic experiencing, I think sensorimotor, trauma-informed stabilization treatment, which I am personally not even familiar with, IFS, and probably many, many other more. Doctor, and very much trauma-informed and viewing things from a trauma lens. But I think most importantly, and that's what we want to talk about today, is the co-founder of MagenU, an organization that's pretty much dedicated to preventing childhood sexual abuse. And I want to dive a little bit deeper because it's something that comes up often as a therapist, more often than we would like to admit. It comes up in the room, and just hopefully have our listeners walk away with some practical tips as parents, as educators, as community lay leaders or whatever, what can be done, and also where they can get more information. So welcome, and I would love to invite you just to fill in the blanks of what I probably missed out on in the introduction.
Sure. It's very nice to be here. Thank you so much. So yeah, I mean, you kind of covered a lot of the basics. Basically, I started out my kind of career journey in going to for audiology. Actually, I have a doctorate in audiology. I always kind of felt myself pulled towards social work therapy, but I was told, like many of us are told when we're younger, that like it's a job doesn't pay well, and you're a very feeling person. It's going to be hard for you. And I took everyone's advice and sort of went a different path. I love school, so of course I went up to doctorate level, and I liked it, for what it was, but I always found myself really being pulled into the counseling aspect of the job, which you don't get a lot of in that field. And that was sort of like a piece of my world. And then I, got married, thank God. And I was in starting to have kids, and my husband is one of the kind of original people in Our Place. He's a founder of Our Place, which is a drop-in center for teens at risk. And so we kind of started to be very involved as a couple in that world, where I would have a lot of these teens over for Shabbosim, for meals and for holidays. And in getting to know a lot of them, I was finding more and more often that the kids had been through some kind of sexual abuse as children, and ended up down this whole kind of journey. And I was really curious about what was happening, and we were very involved at the time with helping kids, get to rehab if they needed it, and counseling and all these different pieces. But it really made me curious about like what is happening here and how we could be preventative. It was really nice to be in it in terms of helping at the moment, but I kind of wanted to know how do we stop these kids from getting here to begin with? Like, what are we missing? I also was having kids of my own, and I was like partly myself. Like, I really want to know how like this happens. So kind of, it felt so frequently. Later learned that it is so frequently, that I wanted to learn myself, what to do about this. And I started to go down this journey around how do we teach prevention to children? What do we as adults need to know? That led me into my next career of going back to school and getting a degree in social work. And then, I'm kind of like a school addict. So I kind of went, continuing and training, and I love the world of trauma. And so I ended up really just getting, EMDR, sensory motor psychotherapy, IFS, breath work. I mean, you name it. There's so much to learn. It's, to me, it feels like, if you're working with people that are really have gone through kind of the most awful things that one human can do to another human, you really need a full toolbox. That's my personal opinion. I feel like there's no one tool that works for everybody. I think everything can work for somebody, but it's got to be, you have to be able to pull out the right thing for each individual person. And so that was kind of my journey. And then working with kind of founding MagenU, which is for sexual abuse prevention, I went down this whole world of figuring out what actually works, right? How do we prevent this? What can we do as parents, as teachers, as community leaders? What do we have to know? What do we have to give our kids? And sort of like kind of took it from there.
Wow. I want to first of all comment on like, probably very well-meaning advice that you're such a feeling person, but therefore shouldn't go into the field of feeling and being with clients in an empathetic way. I would say that today maybe people would say precisely because you're a feeling and empathetic person, that's probably a good place for you to be.
Yeah, probably.
And also like this idea that you went upstream, meaning you've seen that the kids or the young teenagers ending up in our place because of so much trauma in their early childhood, and said like, hey, what can we do?
Yeah. I like how you put
not
that.
End them up.
Right. Yeah. Against the tide, so to speak. Yeah.
Against the tide. Like, let's go steps before the intervention or the crisis.
Yeah.
And finally, just a quick comment on like, yeah, each person absorbs probably some of their story, their trauma in a different way, either more somatically through the body or more intellectually or emotionally, and having tools that can address and talk to and intervene on all those levels probably is a necessary part of doing this work. So not being locked into like this one way of, oh, you have trauma, and now I'm going to try to force you into my box of what I know how to work with it.
Exactly.
Really beautiful.
It's a very, to me, that's like a huge, important piece. I actually, I teach a certification program with two other therapists on how to treat sexual abuse from childhood through adulthood. And one of the pieces that we are constantly really kind of bringing up, no problem, for mental health professionals. And one of the things that we always really talk about is that you can't, just because somebody has gone through sexual abuse doesn't mean that they're going to show up in the same way in the therapy room. There are so many factors that come into play, and you can have two people that have gone through, what we would call similar experiences or under the category of abuse, but there are so many pieces of the puzzle. to name a few, which is like just even not even touching, the whole world of it is, depending on who the offender was, how often the abuse happened, how old the person was when they were victimized, what resources were happening in the background. And these are just like, I'm just naming you like a few, but there's so many that play into what's going to happen with the client in the room, how the symptoms are showing up. And so if you have kind of one kind of trauma informed way of working, it might be helpful, but it's not going to be enough for people coming in that are going to need different things. And I'm really a very big proponent for having multiple ways to work from different angles.
A curiosity question: do you still see private clients, or primarily work with MagenU?
I do. I see private clients. I have a private practice, and I see primarily at this point ages about 16 through adulthood. Yeah.
Okay, what is childhood sexual abuse? What is that? Definition, ideas, like range. What are we looking at?
Excellent question. So should we give a trigger warning for people listening? I mean, we're talking about a topic that's can be very triggering. So I'm just going to kind of put it out there that anyone who is listening that is, has kind of gone through something like this, or maybe sometimes memories come up while we're talking about certain things that weren't, you didn't have access to beforehand. So just to like recognize what's happening and to take a break, feel free to turn this off or to, go do something else in the meantime, or at least use tools to ground yourself if you have those tools, because some of this stuff can be really difficult to listen to. So it's a great question. I think child sexual abuse, when we're talking about definition, if you're going to look up the definition, you're going to find that it varies a little bit depending on which organization is writing it, and that becomes like a bias around what their goal is and what the purpose is. Generally speaking, child sexual abuse is when a child is really used for the sexual gratification of another, right? And that can be another based on, somebody, an adult. It could be adolescent. It could be a peer. But it's something where the child is being used for that gratification, sexual gratification, and then it kind of has there's like a gamut of like categories that can fall underneath what we're talking about in terms of being used for, right? And so that's like the general.
So in this definition, when a kid explores doctor games with their friends, is
No.
that? No.
That's not that one. So that's a great question. When we're thinking about what we would define of like the concept of sexual abuse, and especially when it comes to like peer-to-peer games and things like that, you're kind of thinking about it from when it goes from exploration to exploitation, right? Like there are kind of developmental norms that kids go through when it comes to curiosity and games and exploring that would be under like certain categories based on age of appropriate for their age and like make sense. And then sort of moving into like what are some deviancies around, well, that's not necessarily aligned with normal development. And now we're moving out into a different category. And it's such an important piece. And again, it really is nuance, which is why it's kind of tough when someone's dealing with something like this. It's so important to reach out to someone who really understands what we're talking about and understands this topic and is able to explain it and look for what's considered to be something that would not be okay versus something that, is really just developmentally appropriate. And you kind of just want to redirect the child. So, when we think of it as like everything in this category is bad and, this is all good, it's always a problem, right? There's a lot of there are things that are black and white, and then there's a lot of gray.
What I come across sometimes is that people talk about there has to be a significant enough age difference for it to be not, like you said, exploration, but more exploitation. So if my 10-year-old cousin, while I'm 8 years old, is coming over to my house and says, "Hey, let's explore, let's try this," and so on, most people would say, "Okay, that was just childhood exploration," and And I do see that some people walk away with maybe this was not abuse, but somehow their sexual map was altered.
Yeah, it's important what you're saying. It's like you know, what I think becomes difficult in sort of thinking about this topic from, or depending on what hat you're wearing, it's kind of different, right? There's like the whole concept of, if we're going to talk about this from like a legal kind of consent standpoint, it's going to be different than what we're talking about with when sitting with somebody in a room and they're, you know, kind of have this symptom of whatever it is that's coming up for them around how they process what happened. So yeah, generally under some of the definitions of sexual abuse, and again, really does shift based on where you're looking. It will say if there's an age discrepancy, and they usually say about 3 years, it's like the general, or like a power differentiation, like a power differential, or a size difference, right? Like that's kind of like the general. And that already includes more than just age if you think about it, because you know, size difference can be very different even within peers, right? You can have a kid who's just overpowering to another kid in the same age group, right? But power differential also comes into play. If you have a kid that's more popular, right, or has more power, so to speak, even if they're in the same cohort, same and peers, that could be felt as being coerced, right, being exploited. So it gets a little dicey when we think about it as like a definition of, if it wasn't 3 years apart, therefore it can't be abuse. And I think what's happening for people in that mindset is, we don't want to call a child an offender, right? And we shouldn't, right? Children are not offenders, but it doesn't mean that they can't be sexually acting out, right? I would never call a 10-year-old an offender, but I might say that the 10-year-old is exhibiting sexually harmful behavior. And so the kid who's being harmed is still might be experiencing trauma symptoms, right? And the kid that's harming will need some kind of intervention. So again, like, this is why it's so nuanced and important to really get the full picture around what we're talking about here, and also to know what we don't know. It's almost like we have to know what we don't know and be able to take apart, like, wait a minute, like, can this be something that's a problem? Or what am I noticing? What am I seeing? And what can I do about that?
I think that what I'm hearing from you in some ways is that, yeah, legally there might be clearer definitions of what constitutes abuse versus exploration, but that does not in any way prevent a person or a young child experiencing this as something that is deeply distressing in their life. And there's some nuance as the practitioner, as a therapist, or as the specialist seeing this child, to be able to tease that out and work with that accordingly.
Exactly.
Wow. You mentioned before in your intro that you've noticed that it's way more common than you thought it was or is. Do you want to throw some numbers at it?
Sure. I think it's always hard. You know, these kind of conversations are always so difficult depending on people listening. I find when we hear numbers, usually I get one of two reactions. One is like, oh my gosh, like complete, like overtaking of anxiety, panic, and like, I'm never letting my kids do anything, you know, or like the opposite around, that's not possible. And like total, yeah, it can't be. It's just, you know, whatever. Or they're like, those are secular numbers, so they don't really affect our, you know, our individual kind of, you know, communities. So the numbers themselves, right? If you look at the numbers in terms of from a secular space, are 1 out of 4 girls and 1 out of 6 boys will be sexually abused before they turn 18. Darkness to light, you know, kind of categorized it among, it's an organization that does a lot of research on this topic, did sort of a more global number of 1 out of 10 kids are sexually abused before they turn 18. The reality is, based on anecdotal experience from the mental health world, if you kind of ask anybody who works in this field, they will tell you that the numbers really do add up. They're pretty much the same in our communities. And what's interesting about it is that the numbers are most likely higher than even what's being reported, right? Because if we think about it, these are the reported numbers that are being recorded. And what we know about sexual abuse is that most are not reported, right? Average age of disclosure is about 50, in the 50s. So we know that it's not being disclosed. So most likely the numbers are higher. The reality is that there are certain, it's true when we think about our communities, so to speak, we are going to see different kinds of things than the secular world might see, but we'll see different kinds of things. So, when we talk about, let's say, girls versus boys, so 1 out of 4 girls, 1 out of 6 boys, they're saying that more girls are technically sexually abused, as a whole. But what we know is that most offenders, not all, most offenders are male, even though women offenders exist and the numbers are climbing. But most offenders are male. And because we separate the sexes in our cultures a lot of the time, so in our communities, we might have potentially more victims that are boys, potentially, right? So we don't have so many studies ourselves. We're getting there. There are a few studies that have been done in our world, in our communities. And we're thank God, researchers are really doing well and they're pushing through and we're getting more and more. But we have a lot of actual research to do in terms of documented statistics. But yeah, I mean, I believe the numbers are pretty much the same at this point, and that's important. The other aspect of that I'll say is anyone that gets caught up in it can't be, right? It can't be. Usually what I'll say to that is one of two things. One is, even if it's less, okay, and isn't it still
really
important
matter.
for us, right? It doesn't really
Right.
matter, right? We want to be able to do what we can. And the second thing is if it wasn't really true, right? If, let's say it wasn't true, let's say I'm just kind of inflating this and making this up, right? Think about how many organizations exist out there to help this specific problem. I mean, I could probably name you off the top of my head about 7 or 8. If it was not true, what are we doing all day? What are all these organizations dealing with and doing all day? We're not all dealing with the same people, right? And we're all busy. And so just even in thinking about that, this is challenging for us to hold and accept, but it's just the reality. And if we don't look at it for what it is, we can't actually do anything about it.
Okay, so 1 in 6, and anecdotally seems somewhat supported. 1 in 6 boys, 1 in 4 girls. Potentially in our community, higher instances with boys because of just the gender segregation, and average age of disclosure age 50. And I think another statistic that, please correct me if it's wrong, is that 60% goes unreported. So
yeah, probably more. Yeah,
which really, if you extrapolate from there, it does arrive at pretty serious numbers.
Yeah.
Do you find that there is a difference in the individual communities, in our Orthodox communities? Is there a difference, and maybe separated by the intent, how ultra Orthodox the community is, how larger the segregation is, the interaction between genders? Anything?
Yeah. I love that you're asking that question. Because I've heard that so many times, that doesn't happen in our community. That only happens in the modern Orthodox because they're so free about everything, right? Or no, that only happens in the, in the really ultra Orthodox because they're so closed. It doesn't happen by us. It happens there, right? Because they don't talk about anything. The reality is that this is just part of the human condition. And it happens in every community. There is no community that is, out of the range of, having this happen in their world. It's just part of life. You can ask that about anything. Does any community kind of not get people that have cancer, right? We all have people in our community that get everything. And so there is no difference in terms of that piece. The next question I think that gets asked around this is, well, what about in terms of facing the problem, in terms of opening this up and actually,
Acknowledging it.
Exactly. What do we do? And so even in that, I honestly have found, just based on the work I've been doing for so many years, I have found really closed and open in every community. I don't really find it to be this community doesn't want this versus that community is totally open for that. I really think it's an individual piece. There are individual humans that walk through the world that are really, really dedicated to trying to make things better for all children. And they are open to talking about this and figuring out how to give it over. And then you have individuals that are just very closed around anything to do with this topic, that they don't want to see it. You have therapists that don't want to see it. Interestingly enough, I've had play therapists, child therapists that I've encountered where they'll tell me, "Oh no, I don't treat sexual abuse trauma in children," and I'll say, "Okay, great. So what do you do when you have a client that it comes out? What would you do with them?" And they'll say, "Well, I don't know. It hasn't happened." And my answer to that is, it has, right? It for sure has. You see children, you've seen this. You just didn't know what you were seeing, or you didn't want to see it. And that's just the reality. That's just the reality. And so, whenever I hear like this concept of a community, yeah, every community has their own challenges around this topic. That is true. It's going to look different in every community. But in terms of like, yes, we have this in our community, or no, we don't, you have people, you have it.
And I think speaking a little bit to the piece of like, as a therapist that says, no, I don't seem to have any clients that struggle with CSA. I think energetically, if you're afraid of something, if you haven't worked this out in your own world, people sense that in a subconscious way, and they won't bring, and you won't notice, and you won't see it. But it does not mean it doesn't happen. We see
100%.
this in other areas as well. Wow.
For sure. Yeah.
Talking about the idea that because of our communities that sustain so much traumatic events, so much a history of basically trauma for almost 2,000 years, and even in the last 100 years, very serious trauma, does that potentially create an increase of instances of repression, or even that is an unfair
It's an excellent question. I don't know the research on this. That's actually a fascinating topic. We definitely hold, intergenerational trauma. We definitely hold, we walk around. It's changed literally our DNA. I mean, they have studies now all about epigenetics and how we hold trauma, even in ourselves, and how we pass this stuff down, to our kids, even just in ourselves. So it definitely there is a way that this probably does play in, but I'm not sure if it actually if it would impact how often, or this specific topic around sort of the disclosure piece or the hidden piece. I think when it comes to sort of like cultural trauma, that probably plays into the concept of reporting, or getting outside help for an issue that we don't necessarily know how to deal with ourselves. I think that's where this kind of thing could play in, which does make sense if you think about it. There's a lot of fear about the outside world, especially, the more we live, the more we see that. And because we don't have enough sort of resources or the ability to kind of like figure this out ourselves, it becomes really challenging with, what do I do here? I need outside help, but I don't want to go to the secular world of authorities. That's too scary. This is too scary. That's too scary. I think that's kind of where you would see like this play out a bit.
I have one more sensitive question before we shift a little bit into MagenU, which is not so much about the dealing in acute crisis, but prevention. Do you think, and you can totally decline to answer this one, but do you think that going to the mikvah for young boys is something that should be at least re-examined in terms of preventative or being exposed to it? Because so many of the stories, when they're not incest related, they're not incest based, seem to center around mikveh experiences. Any thoughts
Wow.
on it?
You're really putting me. This is a good. This is like, okay, everyone's gonna be like, she's crazy. Okay, I'll tell you my what I think about this whole topic, and I'm gonna say it knowing that I'm sure there are people out there that are just gonna be like, I'm gonna say it as sensitive as I can, I guess. My personal opinion, my personal belief is that I do not believe that young children should be taken to the mikvah for multiple reasons. Now, I understand that this could be very, feel like it's against, certain cultures, because we know that there are in certain cultures it's much more common than in others. But the reality of the situation is that the way the mikvah experience is set up is one that is not very safe for kids. There have been, we know there have been way too many incidences that have happened in that setting. Not to mention that it already puts a kid into a place of, no clothing with grown men, that becomes more regular. It becomes more normalized. It's confusing. When we're adults, we process things differently. We have nuance as adults. Like, this is okay here, this is not okay there, right? We have that. Children don't necessarily have that ability. And so it becomes like a challenging piece. So I definitely don't think that it's a smart or a good idea. I'll even go one step further, where once we have adults who have been victimized, okay, and now have to go to the mikvah as teens, young teens, older teens, young adults, even fully grown men. The experience itself can be extremely challenging, extremely triggering, and really bring up a whole slew of like guilt and shame around not wanting to be there, not wanting to go, and then needing to go, and then potentially setting themselves back in their treatment or in their healing. It's like a full-blown flashback triggering experience, which makes sense if you think about what this trauma is, even if they weren't sexually abused in a mikvah, but the whole experience of it. I would love to see more like men's mikvahs modeled after women mikvahs a little bit, in terms of a one at a time kind of situation, or at least having the option to normalize that a little bit more, where there is an option where you can be, it's one at a time, and it's something that just, it doesn't have to be this sort of experience in that way. I think that from a sensitivity perspective, that would be really helpful for a lot of people out there, and thinking about how many people we know that we're just talking about could potentially have been victimized. How many people would feel so much more comfortable in a situation like that? So I get that this is a tough topic, and I get that it's not like a simple answer, but I think it's something that we definitely need to think about. If we think about, we think about everyone's feelings in so many ways. This should be one of the ways that we think about other people's feelings.
I really like what you're saying, not just as in terms of, don't do it. And I don't really have another way to think about this, but no, do it in a way that might even increase mikveh attendance. I'm not talking against going to the mikveh, just in a way that people can not have this desensitization as a child to be around adults naked, and actually have a meaningful mikveh experience. I like it.
Yeah.
Actually, before we do go into prevention, is there, and maybe we can dispel this myth, hurt people hurt means that people who have been abused have a bit higher propensity to become abusers. And I think we should put it to bed if it's not true.
Sure. It's completely untrue. It's untrue in so many ways. Think about it. So first of all, if we know that it's interesting if you think about it from this perspective, because if we know the numbers are higher for girls officially, right, 1 out of 4 girls, and we know most offenders are male, then right away it doesn't make any sense, right, to think that that happens, right? Okay, so that's the first thing. The next thing is that I work with a criminologist, and a lot of specific things that we've done trainings together, and we talk about like this kind of topic in general. He specifically works with offenders, and he's done tons of research on this specific topic. And he says, and this is coming from his research and his experience, that most offenders actually have not been sexually abused. But when they get caught, per se, and they're being interviewed, very oftentimes they'll say that they were, because it will give us a little bit of a sense of, oh, right, this makes sense, right? There's a way where there's an empathy piece that gets a little bit kind of kicked up in us around, this makes sense, this is where it comes from, when the reality is that it's probably not true, okay? And so there's a lot, and what's interesting about it is that you'll read, I read a ton of books on this topic, and even within the literature, you'll find very oftentimes it talks about, having the offender that has been abused, and this is where it's coming from. Now, you have to really look at the research of where it's being quoted from and what they're measuring, because it is true that if a child is hurt sexually, they may act out sexually on other kids to make sense of what happened to them. It is true that a teenager who is hormonal, has no education, was exposed to pornography, maybe would have been, sexually abused himself, might feel the need to act out on other kids because he's trying to make sense of all this that's going on for him. Right? It is true that in sorry, in the yeshiva system, in dorms, there is a lot of sexuality that occurs between boys to each other within that time frame of life. It happens much more often than we think about. All of that is true, but it's all very specific around age, experience, what they're trying to make sense of, what's happening. It doesn't mean that those individuals will then grow up to be full-blown offenders. That is a process that happens, and we could probably spend a whole workshop just on discussing how offenders become offenders, right? But that's a whole world. But what parents really need to hear and internalize is that if your child was sexually abused, it does not mean that they have any higher of a chance that they will now become an offender. That doesn't hold true.
I'm glad we can put this to bed, because it is one of the biggest worries as we switch over a little bit into protection of, like, oh my God, my child was potentially abused. Now they're going to turn into an offender. Okay, prevention. I know that you have programs starting from earliest age.
Yeah, earliest age. You could do prevention from day one.
I'm a parent. I am deeply scared by just the beginning of what we've just discussed. How do I make sure that this does not happen to my children? What do I need to do? Tell me what to do.
Tell me what to do. Okay. I don't know if we have enough time for that now. I'm just joking. So listen, the reality is that it really starts first with us as adults. Okay. When I think about prevention, I think of it like a 50-50 kind of deal. 50% is us as adults, really understanding ourselves, our own hangups, what's happening for us around this whole topic, everything we need to know about how to be involved, what we need to learn about just our kids in general and the world. And then 50% is what we give over to our kids around lessons and what we want them to know for themselves. Okay. But it really starts with us, because of course we're going to teach kids prevention rules and different aspects of life, but a kid is never going to be responsible for their own safety and for their own prevention of abuse. So even when we give over pieces to our kids, it's still not on us to be like, well, I taught you this, and so now, this shouldn't happen to you. Like, that's just not how this works, right? We teach kids all the time, right, to not touch, let's say, don't go near the hot stove, but we're not going to let our 5-year-old then go to the kitchen and prepare a whole meal for us, right? That's not what's going to happen. So we have to really think of this in what we're doing. But firstly, the first step that we really need to understand is what does this topic do to us? Okay. How much of this do we understand ourselves? When we think about sexual abuse, what do we think about? What do we think of an offender? What do we think an offender might look like, right? What are we looking for? What are our own comfort levels around things like sexuality, the body, modesty? How do we think about these topics in general? And a big piece is the concept of boundaries, right? What are our boundaries? What do we hold? What's a boundary to us? Are we able to set boundaries? Do we not have a sense of being allowed to set boundaries, or not being allowed to set boundaries in certain situations or with certain people? Once we get a feeling around some of that, we can then feel into it, and only then could we come forward with our kids around these same topics. Because if we can't, children they're not always the best listeners, but they are the best imitators, right? And so everything we're doing is going to be about modeling and about figuring out what they're seeing and how we're giving messages over.
So much to unpack here. So my comfortability around sexuality, does that mean the more comfortable I am with the idea that sexuality is a part of my life, and it could be a beautiful part, maybe even a spiritual part, and I don't treat it like with this the thing that's never spoken about and never modeled in any way or shown in terms of physical touch, maybe to my wife, and not obviously overly sexual, but with the idea that their physical connection is a part of being in a relationship and so on. That is the piece that I need to sort out with myself. Meaning, and so that's one, I think, a statement. What does it mean I need to sort out my feeling about what an offender is and what they're looking like is one question. And the other question was in regards to boundaries. Are we talking about physical touch boundaries, or are we talking about boundaries in all areas of life? Like, are we talking about in invading like dictating every moment of our child, feeling like taking away all of their autonomy? Like, no, you need to know boundaries, or
Beautiful.
is
Yeah,
it
beautiful.
physical?
Excellent. All excellent questions. So, okay. So let's start with the first piece, which is just in terms of, when we talk about comfort level with our own sexuality, I think what we're really talking about here is that it's not about being open and like, this concept of free love and this like, very uncomfortable piece. What we're really talking about is understanding that Hashem created us a certain way, and that it's just another aspect of our lives, and it's a modest aspect, but it's not something that we should be afraid of if our kids have questions about it or want to or need to express something to us. I think that when we start to really panic around certain topics, that tells us a lot about how we were raised and what was okay for us and what wasn't okay. And you don't have to be the most comfortable with this topic. You can even say to a child, like, I'm not sure how to explain that, or like I'm struggling with that a little bit. Let's find somebody that can help with it, or maybe I could find a book on it and we could talk about it after. I know that for myself, like I'm pretty comfortable and open about these topics, but not necessarily do your kids want to hear that from you all the time, right? And so I used to get I found that some books were great. Like there's a book called The Guy Book, or which is like, and it's an American Girl book, and there's one for the girls also. I forgot what that one was called. I have to think about it, but it's basically a basic puberty book. It doesn't talk about sex. It just talks about just basic puberty and what happens to the body. And I remember like when my kids hit a certain point in their life and they were expressing curiosity, I sat and spoke to them, but then I also gave them this book, and I was like, listen, if you want to read it together, we can read it together. Or if you want to read it and come with me if you have any questions, that's okay too. But you're kind of showing that like you're okay with this topic, and they can come to you with questions. So you don't have to be the most open. You just have to be open enough that your child knows that they can come to you with this topic. And so, phrases like, we don't talk about that, right? Or like shutting kids down automatically around something like this. The messaging they get is this is something that's not okay to bring to you. And make no mistake about it, children will have questions. You can either decide if you want to be the one to answer their questions or if they're going to go elsewhere with their questions. Their questions won't go away. It will just be a matter of who's answering their questions. It could be, God forbid, the internet, which is 10 times worse, right? A friend, an offender, right? Or you. That's your choice. You don't get the choice of no questions. You get the choice of who's answering the questions. So that's one. Moving into the offender. What I mean by that is we have an idea of what an offender will look and act like, and we're usually wrong. Okay. I remember growing up and hearing about like the creepy guy on the corner in the trench coat, stay away from that
with
guy.
the van, with the
van,
windowless van.
Exactly.
Yeah.
I got to tell you, like that creepy guy on the corner in the trench coat is probably the safest guy in the room. It's like, what you're getting, right? There's not a lot of like nuance here. It's usually offenders are, think about it. Offenders go after availability and vulnerability. Okay. That's what they're looking for. So these are individuals they have to have access to children. And they have to have access to our children. These are people that we know really well. As hard as that is to understand, if we don't understand it, we can't do anything about it, right? So we have to understand that this is about knowing that you want to know what an offender looks like? Look in the mirror, right? That's just the way it is. So we have to sort of move away from in our minds thinking, oh, that person looks creepy. Or I don't really, this person is not as religious. And so there potentially might be a problem, right? Or, whatever we're thinking about. We have to really start to look more about behaviors and not about the individual person. It's more of like, what is this? What's happening here? What's the behavior? Do I have like a gut feeling about this? Like if it feels wrong, it probably is. I would say trust your gut is probably the best advice. And this brings us actually into the boundary piece, which is we really very often override our own gut feelings. We override our own boundaries to please everybody else, right? It's not nice. It's going to make the person feel bad. I'm being silly. I'm being overprotective. Everybody else is doing it. Everybody else likes that, coach, piano teacher, whatever it is. So it must be me. If you have a gut feeling, trust your gut feeling. Okay. That's the most important thing. When it comes to boundaries, so boundary work, listen, boundaries is a whole topic, and we don't have enough time to talk about boundaries as a big thing. But if we think about it in terms of just regular understanding, the concept of boundaries is that you can't have any relationship in life without healthy boundaries. Not a spouse, not a friend, not a coworker. There doesn't exist as a healthy relationship without understanding what a boundary is, your own, and how to keep somebody else's. Okay, and that includes a few different pieces. There is obviously the physical boundary, which is a space thing, right? Which is about protection. And then there's about the inside, about like an internal boundary. That could be emotional boundaries, social boundaries, financial boundaries. You could use it, you could take it anywhere. But it's about the inside around what am I okay with and what am I not okay with? What are my values? What am I telling this person about me when I set a boundary or don't set a boundary, right? And so if you think about it from the perspective of, the way we sort of walk through our world, it's like, think about it. So the quintessential example for a kid is, your grandma is coming in from Israel, telling your kid, go kiss grandma. It's very, very classic example. Okay. Go kiss, you haven't seen her. She wants to kiss you. You need to kiss her. And kind of breaking this kid's boundary around like, you have to do something with your body that you don't have a choice on because this is a nice thing to do. Right. But the step is even more so about us because I might not want that. I might not want my kid to kiss grandma, right? Or I might not want, the neighbor who comes over to be like playing with my kid and picking them up or tickling them. I might have a yucky feeling about that, but I stop myself because I don't want to look like the overprotective parent or the one that's making this person feel bad. I'm overriding my own boundary, right? To stop it. So of course my child's not learning anything about boundaries, right? That's like a tiny piece. Take it even a little bit further. if you think about a day in a kid's life, we do this to kids all the time, really, right? Like think about an example like you get your child a toy. Let's say you get your child a special coloring book that's theirs, right? And then their sibling or a friend wants to use it. And we say, could you let him or her color one of the pages? And the child says, no, it's mine, right? And we start to get a little bit panicky around my child doesn't know how to share. It's not good midos, right? And so we push, it's just one page. What's the big deal? You have all the pages. Why can't you just let your brother or the friend use a page? If we're by other people's houses, we get embarrassed. This person's going to think that my kid is selfish. And so we get angry at our own kids for not wanting to give away something that they have because we're trying to figure out how to help them, quote unquote, share. Now, I'm not against sharing. It's a great thing to do. However, who do you think is going to share more? The kid that's constantly being told he has to give away his stuff, or the kid that's being told, you know what, that's yours. It belongs to you. It's your decision. You get to decide if you're sharing or not. Respect, right? Then you respect the other kids crying. You really wanted one of those coloring pages. It's really hard for you not to have that, right? Empathizing. And then when there's a quiet moment and he's not, your child's not using their coloring book, they moved on to something else, maybe then you want to sort of go around and be like, hey, I noticed you're not using that toy coloring book right now. What do you think about letting your friend use it for now? Would that be okay? You're helping bridge pieces, but the first step is what's happening for me in this moment. If I'm coming from a place of like, I need to take care of myself, I need my kid to take care of me, right? I want a hug. I had a really long day. I want a hug and my kid's pulling away and, oh, I'm so sad. Mommy really wants a hug. It's not fair that you don't want to give me a hug. That's about me. That has nothing to do with my kid, right? That's wanting my kid to fulfill my need. And so all of those tiny pieces, that's all prevention. The more we like tap into that, it's drop at a time. People think of prevention as like, no one's allowed to touch your private parts and like that's prevention. But that's not. I work with survivors a lot and I find that a lot of people were told that exact statement and they still got sexually abused, right? So clearly that's not the crux of prevention.
So, what I heard is that boundary work is my boundaries. I need to learn how to respect my boundaries, and I need to learn how to respect my children's boundaries. And not always, and most of the prevention work is not about don't touch private parts, might not even work, but is when I can teach my child through absorption and through modeling that you have a right to your own body, to your own decisions, to your own autonomy. That is what's going to help them in that moment say, no, absolutely not. Not like direct instruction.
Exactly. 100%.
No.
Yes.
So first of all, easier said than done, because especially in our communities, I think the idea of sharing is caring, and all those, and family, very close family systems probably create difficulties around some of those boundaries.
For sure. But think about what you just think about that sentence, where we always focus on loving your friend like you love yourself, loving your friend like you love yourself. But the first part is loving yourself. Right. If you can't take care of yourself, how can you possibly show up for another?
So how does prevention at the early age differ from, you have programs, like you said, for preschool, toddlers, and then through the different ages in school? What does it look like practically? Yeah. If most of prevention is boundaries and teaching and respecting boundaries, how do you differentiate it across the ages?
So what you're really doing is you're taking concepts, right? The concepts are really kind of similar. We understand the concepts of boundaries, consent, right? Understanding their bodies, body safety rules, trusted adults. The concepts are the same. It's just a matter of understanding how to expand and like build on foundations, right? You're taking a kid as they're getting older and you're helping them understand bigger concepts. So for example, when kids are little, when you have little ones and you say that the concept of, let's say, secrets, there's going to be a general rule for little ones around we don't keep secrets from mommy or daddy, right? There's a general. As a kid's getting a little bit older, you're expanding it into what's a safe secret, what's an unsafe secret, and what's a surprise. You're giving them a little bit more information because now you have older kids who are starting to have safe secrets like, oh, my friend told me that his mother's having a baby, but I can't tell anyone, right? Or we have a secret handshake, the two of us. That's just we do, when we see each other, but nobody knows, right? We're starting to understand that this is just reality. So you want to start building on those concepts. And then as a kid's kind of getting more and more older in terms of understanding, you're building in the concept of privacy. Sometimes we have things that are private, but they're not necessarily a secret, right? I sleep with a teddy bear at night. I want to keep that private. I don't want all my friends to know when they come over. It's not a secret, but it's also something that I want to keep private for myself. I go to therapy. Right? I don't want my friends to know that I go to therapy. I don't think of it as a secret, but it's private, right? And so you're sort of taking concepts and age appropriately, you're kind of building it as they grow and building it into their system. So this is with a lot of different concepts, right? Think about understanding the concept of body safety rules. Your body safety rules are that no one should be touching the private parts of the body, no one should be looking at the private parts of the body, and no one should be talking to you about the private parts of your body. And you shouldn't also look at, or talk to someone else's, parts of their body that are private. Those are body safety rules, right? Now, when kids are little, you are helping them. You are helping them to shower. You are helping them clean themselves after they toilet. You're helping them get dressed. You're in that, right? So you're helping them understand that there are health and safety reasons that might happen, right? And as you get older and you're more able to do some of these kinds of things, you're going to have more and more privacy, right? You're going to be able to do these things more and more on your own, and that's going to be yours to do, right? You're starting with that. And then as they're getting older, you're noticing that, oh, I'm helping you in the bath, but now you're able to wash your body yourself. So now I'm not going to do that for you. You're going to do that for you. I might supervise the first few times and make sure you're doing it properly. And then I'm not going to supervise that anymore. And that's the building of how you're sort of dropping these into their system and kind of building it up. You're changing a baby's diaper and you have older kids around, right? So you're changing the baby's diaper and you're narrating it. Oh, got to change the baby's diaper. Yeah, I'm going to clean the baby because that's a health and safety reason, right? The baby can't sit in their dirty diaper. That's not healthy. I'm going to open up the baby's diaper. I'm going to quickly clean them, and then I'm going to close it up. Would I leave the baby's diaper open for a long time and do other things or walk to the kitchen? No, that's silly. That's not safe for the baby, right? We have to keep the baby's private parts covered. So we're going to clean the baby and close it up. You're modeling, right? Everything you're doing, you can do prevention in a very easy way without kind of being this, like, let's have a serious talk about this topic. It's just the way you bridge the world, right? When you're giving them the concept of body safety rules, and then they go to a play date or they go to their cousin's house and they come home, it's checking. Oh, hey, how was it? Like, oh, I'm wondering what kind of games you played. I'm wondering what was different in their house than in our house. And oh, did everybody keep the body safety rules? Right? It's kind of like a way of just building this into just part of the way you are parenting.
So, to this specifically, how do you, and I think you answered it, maybe just maybe revisit it just for a second. So I'm giving my 3-year-old a bath. Obviously, I am there for their safety, for their physical safety, drowning, etc. My older child, I am simultaneously also trying to teach them that nobody gets to see you naked, not even maybe Tati, Mommy, or Bubby, Zadie, brother, or whatnot. How do I create, and I think narrating, I think, was a little bit what I picked up, is that I narrate that, oh, I am doing this for this child because they are not able yet to do this for themselves, and I need to make sure they stay safe. While as they get older, probably they're going to do this on their own. And also a lot of it is absorbed through action, through them watching the stages naturally progressing.
That's right.
You mentioned a little earlier, look in the mirror and see an abuser or see an offender. In other words, I can be an offender. A parent can be an offender, a spouse, a grandparent, an uncle, a sibling. So how do I look for warning signs? Myself, I probably won't be looking for warning signs, but if I'm a parent and I want to make sure that within my family there is a certain siblings,
Yeah.
I wanna make sure that things are okay without making it unnatural. Like siblings do roughhouse together. They do play long Shabbos afternoons. They do build tunnels out of chairs and blankets and so on.
Yeah.
What
Yeah.
does prevention look like in that space?
So it's a great question. I think that when you're setting your house up in a way where we have family rules, right? In our family, the rule is, and sort of like whatever comes after that. You're really you're sort of coming at it from two angles. It's the family rules around the structure, right? In our family, we don't play behind closed doors, right? In our family, we check in with with mommy or daddy before we change our location, right? Before we go to someone's house or before we do something that we like somebody asks us to play, we check in, right? In our family, we ask before we touch, before we sit on someone's lap, right? In our family, even if we're playing roughly, we pause and we check to see is everyone keeping the body safety rules, or is everyone okay, like that this is plays that we're just playing like this. Those are family structure rules, right? And then there's like the concept of the nurture, which is really being open around what's happening around you. If your kid is complaining or you hear them whining or fetching around, this sibling is bothering me, or I said no and he keeps doing it, or he's hurting me, or whatever it is, even if it's a regular argument, our nurture is not to sort of be like, oh, like, they're just playing, that's just sibling behavior, or again, you're crying about this, and why are you playing together if you don't like it? That's our instinct as parents. And sometimes it's hard. It's frustrating. We have other kids. There's other things going on. It's not easy to stop every time and get involved. But what we want to do at least some of the time, right? At least some of the time is to really pause and be like, whoa, like what's happening right now? It sounds like you're really being hurt. What do you want to say? Or what do you want this game to look like? Or, is there a way that we can tell your sibling together that like this is getting too rough? Or what are the signals that you're not having fun anymore, right? You want to be the parent that your child can tell you what's happening without this like shutdown mode of your feelings are kind of bothering me, or there's a place where you're at fault, you're choosing to play, therefore just go along with whatever you're playing, right? It's a combination of the way you're setting up your household. When you're giving some of this education and you say exactly these pieces, like everyone has to keep the body safety rules, even your uncle, even your brother, even the babysitter, and you're adding people in, you're giving them the message that this rule is for everybody, right? They can tell you if something's not okay. And that's the next piece, by the way. When you say to your child, here's the body safety rules, everybody has to keep the body safety rules. And if somebody doesn't keep them, it's so important that you come tell me about it, right? So why is it so important? Why should you tell me? Because not everybody knows the body safety rules, right? Not everybody knows them. Not everybody knows how to keep them. And if you tell me, then I can teach it to that person. I can help that person know. And what you're doing there is think about when we think about sexual abuse, what do we know? We know that most kids never tell. They're scared to get somebody in trouble. There's 1,000 reasons that we could list of why a kid would never tell, right? And what we do when we step in with, it's so important that you tell me, because not everybody knows the body safety rules like I'm teaching you. And if you tell me, I can teach it to that person. You're taking out all the energy from this person's getting into trouble. Everyone's gonna be mad at me. Whatever's going on with that dynamic, because we know most offenders are somebody close to the child, right? So we're taking out all the energy from that by just saying, like, listen, this happens and some people just don't know them. And if you tell me, I can help with that, I can teach them, then there's no repercussions. You're giving a kid a way of telling without repercussions. And that's huge. That's huge.
I think, in other words, like, I can tell my kids from here to tomorrow, if somebody breaks the body safety rules, come to me. But if they in any way feel that they are going to be threatened, either by throwing someone under the bus or by you losing your regulation and getting all dysregulated and freaking out, whatever the scenario is, then they won't tell you. So it has to be safety, secure space before any instructions can even be had and listened to. You know what I mean?
Exactly.
Wow. How do I have age appropriately the conversation with my child about puberty, about their getting their period, if they're a girl? Like, normally there's an assumption that there's like a natural curiosity that they will come to us with questions, at least if we created the safety. But what happens, like, I have a child, I want to begin gently the conversation around period, why boys are anatomically different than girls. And she's like, no, don't talk to me about this. I'm not interested in this conversation. How do I go about that?
Yeah. So I think that when it comes to these kind of conversations, you do need some buy-in, right? We don't want to be talking at kids. We want to be having conversations, right? And there are some kids that are really ready for these kind of conversations really early. And there are kids that are just not going to be ready till a little bit later. And I think that there's no timeline. I think we think about this as like, this has to be done here or there, right? And I think that there's a way where kids know, they kind of have a sense of what they're ready for or not. If a kid is resistant to wanting to hear, like, you're ready to give them this talk and they're just not ready to hear it, I don't believe in forcing a kid to know certain information, right? You might say something like, listen, there are some pieces of information that I think would be very helpful for you to know, that are kind of important, and I would like to have those conversations with you, but if you're not ready for it, at least I'm going to give you this book. And if you can read it on your own and then come to me after if you want. But, we're really blessed today to have so many pieces of information that are available to us. The Wonder of Becoming You is a great book, Jewish book around it's a classic that I think will at least we hope girls are reading at an early age. There are books for puberty. There's a Rabbi, I think his name is Rabbi Tenenbaum, who has something called Big Talks, which I think is phenomenal. He talks to boys about their bodies in puberty. He has even like a video, like a USB where you could literally put it on and he talks directly to the boy, like, listening. It's very, very helpful. There are ways to do it without you being the one to do it. Some kids can't tolerate you sitting with them one-on-one and having this conversation. They need more of like their own kind of space and then kind of coming together. As I think you really have to like gauge into which kid is needing what. Ideally, it's wonderful to sit with your kid and have this conversation. But if they're going to shut down around the conversation, then what are we benefiting? We're not really benefiting in that way. If a kid's really resistant and you say, okay, listen, I'm here when you have any questions, right? I'm open to whatever it is. So you're giving them the message that when they're ready, they can come talk to you. Kids are funny. I think they're we think of kids in like this linear sort of developmental path, but I don't think it's so linear. I feel like kids can be so mature in some ways and so much younger in other ways in the same sort of system that we feel sometimes that it's like, oh, they should be doing this, but then they're not, and it's confusing, and we expect certain things. And I think it's important to remember that it's not necessarily about an order. It's about what each kid can sort of tolerate and handle and take in when. And some kids are going to be ready earlier, and some kids are just not ready till much later.
And not to freak out about that either as a parent. Just
totally
respect your child's psyche. It will let you know when time comes.
100%. As long as if you're grounded and open, that's what matters.
Right. Meaning, if you're a safe place to have the conversation when it's time, don't worry.
Exactly.
What have we not talked about that you think would be helpful for someone listening to
Parents,
this
yeah.
podcast?
Yeah. I think let's talk about trusted adults for a minute because I think that's important. I think when we're talking to kids about, which is really on this topic, sometimes we're not the go-to for a kid to talk. Like, and that's as a parent, it's just the way it is, right? Sometimes parents are not the go-to, which is okay. It's not the end of the world. But we do want our kids to know that there are people that exist out there in their lives that they can talk to, right? Trusted adults. We want children to have trusted adults in their lives that they can go to when they need to talk about something, anything. And so you can start this when kids are little, and you can kind of periodically go through this with kids as they're older. And you sort of, kind of bring this up around like, what do we think a trusted adult is? Like, who do you think some trusted adults in your life are? And you let kids sort of brainstorm with you who they believe they can trust. And you start to notice, first of all, it's a great activity because you start to see who kids really would go to, who they do trust. And you can kind of like wean that out a little bit around like, oh, you picked the mailman and that's great. And he's super nice. And, we don't really know him so well, right? We don't know what, like, let's think about it. Like, do we know where he lives? Do we know, does he have any kids? Do we know what kind of person he is? Like, yeah, he's nice, but we wouldn't necessarily call him a trusted adult. We can call him somebody who delivers our mail. That's nice. It's almost like you're categorizing for your kids. And so you come up with like a list of people that you both kinds of agree on that can be trusted adults. Then you want to say to your kid something like, well, how do we know that somebody's a trusted adult, right? How could we know that? And there are like things that we can kind of think about that we can decide if they're trusted. And here are some rules that I know that might be helpful. A trusted adult would never break a body safety rule, right? Trusted adult would never break a body safety rule. A trusted adult would never ask you to keep a secret. And a trusted adult would always believe you and try to get you help if you needed it, if you came to them to ask, right? And you're going to repeat these things multiple times in your life. A trusted adult would never break a body safety rule, never ask you to keep a secret, and always believe you and get you the help that you need, right? And so you're laying down the foundations. And then you can kind of play around with it. You can play like a what if game. You put Ann so-and-so on your trusted adult list. What if Ann so-and-so tells you, I'm going to give you soda after dinner because mommy told you you're not allowed to have it, but don't tell her because then she won't let me come babysit anymore. Uh-oh, what do we do, right? Uh-oh, she asked you to keep a secret. That means she might not be a good trusted adult, right? So we can talk about that. We can figure that out. Maybe we have to cross her out and add somebody else. Maybe Ann so-and-so just doesn't understand the concept of the trusted adult rules and we have to talk to her about it, right? There are ways to like negotiate this, but it's a general template around how they view people and who might they want on the list that might then be taken off the list, right? They put a teacher on the list that's their teacher for that year, and then they move on to the next grade and you review their list. You might say to them, do you want to keep Maura so-and-so on? Or is she still someone you would go back to? Oh, not really, because now she's not in my classroom anymore. Maybe I'll move on to somebody else. But you know what? I don't really want to put my Maura from now on there. Okay, great. So we don't have to put a Maura on there. But maybe I like the school nurse. Great. Let's put the school nurse on there. So you're sort of like in this conversation and it's a negotiation and it changes. And it changes and it's okay. It's okay that it changes.
I love it. So basically using the conversation around the trusted adult as the safety building, as the explorative space of what does it actually mean to be trusted and so on, and to continuously use it as a check-in point and as a furthering point of education.
Exactly.
I'm getting the feeling that so much of prevention is there's no like easy tricks. There's no like, hey, oh yeah, say those words, don't do those things, and you got it in the bag. It's really like a continuous modeling. And yes, there are some tools that we can use to model and to have these safety creating spaces. But it's about safety, it's about modeling, about honoring boundaries, internal and our children's boundaries, and based on those tools, building this rapport and space.
That's right. I mean, think about it from everything else that we know about kids. Like if you want to know what's happening in your child's classroom, play school. and have them be the teacher. You'll know everything that's happening in school, right? This is just how kids are. And so when we know this and we can sort of use that also, use ourselves, there's no greater tool for your kid than you as a parent. Like you are the person who knows your child best. Use yourself in the modeling. Like think about, you can make things up. It doesn't even have to be accurate stories. Like, if, sometimes you can come home and give your kids a story like, something, oh gosh, I had such a hard day. Because a lot of parents will tell me that their kids don't talk, right? How was school? Fine. What did you do today? Nothing. What do you eat for lunch? Nothing. And you're like, oh, I'm glad I paid tuition, right? For all this, nothing, right? But there are some kids that just they're not communicative like that. But you can be communicative, right? You can be talking about, I had a really, my day was pretty was okay, I guess. But, I was, in the morning, I went to the store to get something and I was online and there was this person behind me and they were standing so close to me and I could literally almost feeling them like breathe on me and I was getting so anxious. You know what that means? Have you ever felt like that? My heart started to pound. My stomach kind of got like very tight. I kind of was like really frozen. Like I don't know why I couldn't say to them to move back. I lost my tongue. Like I had no words. And until they moved and then I was able to breathe again. You know what I'm talking about, guys? Like anything like that ever happened to you, right? You're using yourself. And it doesn't have to be a real story. You can make up a story about yourself and say now we're talking. Oh yeah, that happened to me too in school the other day. Like my friend pushed me and all of a sudden you have a whole world of like conversation around body sensations, what it means, what do those feelings come up? What does it mean to be frozen in your system, right? The way normal, that's just like a normal thing. We're communicating. We both have feelings. I'm like this too. It becomes like a beautiful way of like teaching kids without sitting down and being like, let me tell you something, right? It's true. You have to teach kids body safety rules and you have to talk to them about trusted adults and you got to talk to them about basic concepts, which we teach in the programs that we have, but it's peppered into conversations, modeling, knowing yourself. If it's not done like that, it's just a lesson. It's just a lesson like any other lesson. And there's a very good chance that they're not going to actually internalize it. And if you're saying something and then doing something totally different, for sure it is not internalizing it.
Right. So like you said before, you're talking at them, you're not talking with them.
That's right.
So who reaches out to MagenU? Parents, educators, lay people? How does it work?
So anyone really. Parents very oftentimes call and, I do parent workshops. So sometimes we just do those. Or they'll say, I really want you to come to my kid's school. And they'll sort of like call their principals and ask them to, to kind of consider it. And then I'll have someone from the school reach out and we can talk about, what that will look like. And so it's really dependent on who feels like this is something that's important to them. I think for me, this is really a community sort of effort. We all, it takes a village to raise a child. It's true. We can't do this alone. It's got to be a joint effort. So, for me, going into the school system is a really nice thing. Research does show that kids that are taught in a school system generally are able to disclose a little bit easier for multiple reasons. But when we get the schools on board with parents, it becomes like a unified, like we're able to speak the same language. There's a lot of safe spaces for kids in that way. And so, if anybody's listening and they feel like this is something that they would want kind of education with their kids, they can definitely reach out to me. They can find me on my website, MagenU.org. They can email through the website, that they're either, if you want a workshop, just a few parents together themselves, just want to talk individually, like for the school, 100%. Like there's no right. I don't think there's a right or wrong way to do it. Anyone who wants education, I'm willing.
Is there anything else in terms of prevention that we didn't touch upon, or probably a lot? But I'm saying like as a quick overview, if this were if you view this as a helpful space for parents.
Yeah, I think that honestly, if I had to like say, kind of summing it up to a certain place, I think that, children are not mini adults. I think that we have to understand children as it's kind of its own culture. It's like the culture of childhood. If you think about it, what's a culture, right? They have their own dress. their own language, their own behaviors. That children have all of that, right? They have their own worlds. And for us to really understand what's happening for them, we really kind of have to get a little bit more into the culture of childhood and be respectful of it. And when we do that and we see what's in front of us, then we don't have to control, right? We don't have to control them. They're not like extensions of us. They're their own people. And then we can sort of step back and notice what's happening for me and what's happening for them, and how we can sort of like, be together in that way, but be respectful of each other.
Wow.
Yeah.
Basically, respect the child's autonomy, even though they're not an extension of you, and they'll never be they have their whole full world, just like you, just in a different way, and respect that.
That's right.
I have like a couple of questions I'd like to ask at the end of the podcast, and this is more personal. If you had a message, something that you've learned, absorbed, realized in your own life, and you have the space to share it with the world, what would it be?
Wow. What would it be? I feel like honestly, I think it's do your own work. I think that, we a lot of times get caught up in wanting to do for the clout. I know I was definitely that person, am that person, and it's beautiful and it's wonderful. But the more you know about yourself, right, the more you pause and really do your own work, the more you can show up for everybody else. Like it increases your ability to do that. It doesn't decrease it. And I think that's something that I've learned along the way.
So the more I do avodas atzma, like self-reflection, self-betterment, it will be for my children, for the cloud, for everyone. No, everyone will benefit from that. So don't see it as selfish. See it as a necessary piece of doing it all.
Yes.
And in terms of like a habit that you've internalized, if I do this, take a minute, whatever it is and I think that if people were to maybe do that habit or this idea that worked for you, that can be helpful to them, what would that be?
Honestly, I think if you're struggling with like older kids, like once kids pass a certain age, and it's hard to like be regulated around them, I think one thing that always worked for me was keeping like a picture of them when they're little, like holding like a picture of them when they're little, like accessible, so you can look at that first. So then when you turn to your older kid in this big body, right, you still have this vision of understanding who that person in front of you is. It brings a different part of yourself forward, and always helped me be calmer, and always helped me sort of talk in a little bit of like a more child part way, even if the kid was like a teenager in front of me.
Wow, that is really I relate to it as a parent, and I think this what a beautiful way of evoking in us the hey, I'm a parent to my child, and even though my teenager is maybe defined and finding their own individual self, and it doesn't look so pretty or feel so pretty, but this is my child, my little yummy
That's
yumpkin.
right.
Yeah.
That's
wow.
Right. Yeah.
I really want to thank you. Thank you for coming on. I've learned in this podcast a tremendous amount. For that, I am very, very grateful. But I really want to thank you for the time, the effort that you put, first of all, into this podcast, but also really heading up this organization that probably has touched and probably prevented thousands of more incidences. God should bless you with strength to strength. And especially because you're upstream and you're working on prevention and connection and safety way before that it is crisis. So God bless you.
Thank you so much. Thank you for having me.
Thank you. Have a beautiful, beautiful rest of your day.
You too. Thank you so much.
Take care.